Well, hey everybody, it's Sandy and welcome back to my channel dedicated to helping you advocate for your own health one topic at a time. So guys, today I got something that's not COVID. Yay! I said in a recent video that I was going to do a video talking about medical gaslighting, and a friend of mine actually sent me a message asking me, could I do a video on this? And so I mentioned it, and I got an interesting comment in the comment section of the video in which I mentioned it. And it was written by somebody who I believe was a mental health practitioner of some sort, and said, I don't like the term medical gaslighting. I just think it shuts down discussion, is the way she put it. And she went on a little bit more about it, but that really grabbed me. And I thought, the truth is that's true for me too. I mean, I wanted to do this video about that because I do think there is an issue that exists there where sometimes we walk away from a conversation with our doctors where we sort of just feel like we didn't get what we could out of this discussion, or we just felt like we weren't really listened to or taken seriously, or I'm sure we've all had this experience. But when you say gaslighting, I guess the reason that shuts down the discussion is that it sort of defines that I'm the victim and that person was the perpetrator, and therefore there's nothing I can do. And when you do that, then there's nothing you can do, and so that situation doesn't get any better, and then you get the rights to complain about it. And in general, I started my channel with health advocacy in mind, to help people, to empower them and help them get the results they want. And so I decided instead to break this down into a number of tips to help you get the most out of the relationship with your practitioner. I anticipate that any one of these tips could be its own video, so bear with me. I'm going to try to be concise yet thorough at the same time. And I do anticipate that I probably will do some more videos on this. So I would appreciate generous comments down in the comment section about any direction that you'd like to see this go or any further elaboration. So I've broken this down into 5. I've saved the best one for last, so make sure you hang in there for the 5th tip, because that one could save you from a near catastrophe, and it's something that I've seen play out a couple of times in my career, and it's important. So yeah, I'll get into it. So tip number 1 to get the most out of the relationship with your practitioner is to make sure you're going to the right person. Now, I know that a lot of us have managed care plans now, and some of us have more choices than others about who we go to, but you usually have some choice. So this breaks down into 2 subcategories. The first thing is, hopefully it's somebody that you feel you can somehow find a rapport with. It might not be perfect, or it might be. You might have enough choices that you can find somebody that you have a great rapport with. Now, that doesn't mean they say yes to everything you want, and it doesn't mean that you drive the bus, but somebody that you can talk to, that you feel takes you seriously, that respects you, that you feel validated when you walk in there. But it also breaks down to another category, which is, are you going to a generalist or are you going to a specialist? So there's nothing wrong with having certain conditions treated by a primary care provider. And a primary care provider is certainly able to treat, let's say, for example, a thyroid problem. But my guess is that if you are going to a primary care practitioner for your thyroid problem, that person is drawing labs like a TSH, a free T4, maybe some kind of a T3. There's a couple different tests there, but that's about it. And they're just looking kind of big picture and, not very nuanced. They might also be medicating your TSH, down to a certain level, but not down as low as maybe somebody whose dedicated practice is to endocrinology or to thyroid in specific. So if you go to the specialist, you're probably going to get some more nuanced tests. You're just going to get a lot more nuance there. And you're going to be able to get down to a little more nitty-gritty on any one of these issues. Now, that doesn't mean you need that all the time, but I think you need to ask yourself, is this something that I need? Am I feeling particularly bad despite the fact that this lab is only a little bit abnormal? That's just a thyroid example, but there are any other number of examples. So, do you want to go to a specialist where you can really get down into the nitty-gritty? Then that's going to be the person you're going to go to, because your primary care practitioner has, sees in one day a respiratory illness, a twisted ankle, patient complaining of belly pain, all kinds of things. And it's sort of, in a crude way to put it, the jack of all trades and the master of none. So if that's what you need, hey, I'm all for it, because I don't want to have a million different doctor's appointments, all year, and this is just something that I have to do all the time. Let's go to 20 different doctors. I love the one-stop shopping, but only if it works. So go to the right person. Tip number 2 is, don't bury the lead. So by this I mean, go to the end first when you go in there with a problem. Okay, you can't expect somebody whose time is so tight to really hang in there. If you're going to walk in and say, well, I noticed like 6 months ago I was working in the garden and then my hands started hurting and then the next day, no, don't do any of that stuff because you're going to lose people. So go to the end, don't bury the lead, okay? Hi, I'm here because I've been having pain in my hands. And from there, you can widen the scope instead of starting with the beginning and then narrowing it, okay? From there, you can widen it and say, you know, I first noticed it was about 6 weeks ago, and it was after a day of gardening. And then you can go on to say, you know, anything that made it better, anything you noticed about it at all, or you can pause and let them ask you some questions. I'm going to get more into, you know, what kinds of things, how you would know what to say. But most likely this will prompt some questions on the part of the practitioner, but it shows tremendous respect for their time. It's very, very hard to keep track of all the details when you ask a patient, hey, what's going on? And the patient starts with some like really long roundabout thing and they get down to the end and it like almost has nothing to do with what they started with. And then you kind of find yourself like backtracking. You're trying to remember like everything they said because it's not put in a context that really makes any sense. So this is something that I think we all have control over. So don't bury the lead. Start with the end when you go in there with a complaint that you're trying to figure out, you know, what's wrong. Okay, tip number 3, take 2 kinds of notes. So this kind of bolsters the tip number 2 that I just went over. You're going to take one kind of notes, which is you're waiting to get in to see somebody because you've recognized this problem. So I'm going to go back to the example where you notice you have some pain in your hands. So you don't know, is this like arthritis? Is this injury, just repetitive stress injury? Is this some kind of a rheumatologic condition like autoimmune disease? There's all kinds of things like on the list of differential diagnosis when it comes to, you know, hand pain. So what you're going to want to do is like you're going to make this appointment and now you know it's in 2.5 weeks. So between the time that the symptoms started, probably you didn't start journaling right away. But once you decided this was important enough to get with a practitioner about, you're going to want to start journaling if you haven't already. And that way you're going to be able to look back. By the time the day before the appointment arrives, you're going to take a different kind of note, which is more of a quick, brief outline with some bullet points. And you're going to have a little bit of hindsight and be able to look back and say, you know, it seems like it's more in the morning, or, you know, it seems like it's always both sides. It's never really just one side that I have this problem on. Or it seems like if I rest it or if I ice it, it gets better and heat makes it worse. Or, you know, whatever it might be. You're going to have a little hindsight if you started journaling. And then again, you can make the most of your time and your practitioner's time. And you can even say, after you've given them the bottom line and not buried the lead, I'm here for this problem. And I've actually taken some notes because I've been watching it over the last few weeks to see if I can see any patterns here. So when you finally come in to see the practitioner, you're going to have that narrowed down into just maybe 4 or 5 bullet points, just the important things that you want to remember to say. Because again, you're starting with the end, you're not going to bury the lead, but then you don't want to forget, like maybe there's a few different important things you want to tell them. This happened last Tuesday that kind of made me wonder about it. And so just put those in the bullet points and they'll see you've got some notes, or you're pulling out your phone, you've got, you know, a list written down, and tell them you've got that. So, okay, enough with that. 2 sets of notes. Number 4 is, if you think you've got some weird sort of rare thing, this just seems like something you've read, or you've done a little bit of your Google searching, you've consulted with Dr. Google. Now, this is not to say that that stuff never turns out to be the case, but it's rare, okay? So when somebody does a workup on you, you present with a complaint, they are going to start wide, and then they are going to narrow in on a diagnosis. So if you really feel, for whatever reason, convinced that you have, you know, disease X, it's probably not really well advised to walk in there and say, I think I have this. But once you've gotten the conversation going, it's appropriate to say, you know, I read about this, and I have to say it kind of resonated with me. Okay, and that way you're not like driving, because I think this is one thing that kind of, it gets you off on a wrong foot sometimes with a practitioner, and for good reason. It can be a problem if the patient is the one sort of driving the bus, because you can miss things. Okay, so if somebody walks in and says, I think I have this, and you find yourself working up that because that's what the patient said. Now you're ordering this one test to look for that one problem, and if it's not that problem, it rules out, then you're still back to square one. So you really do want to let people do the proper work that they have to do to arrive at a diagnosis, and that usually involves starting wide and narrowing it in. Okay, so you want to let them do that. But at the same time, you might have a very good sense that this is something you've got. You've talked to other people. Somebody in your family had this, whatever it might be, and you don't, want to walk away feeling rejected about it, and you don't. Part of that, maybe comes from being a little too pushy with some of these things that are just sort of shots in the dark. So you can sort of mention that. And another really important thing would be to bring some research if you have it. And I'm talking about things like if you find a PubMed article or something like that. You don't want to bring something in from like Mary Jane's Health Blog or even Sandy's DIY Health Advocacy YouTube channel, because that's not really sound science when it comes to what's going on with your condition. So certainly if you have to go there, and this is the kind of thing that tends to get people on sort of shaky ground when it comes to having a good rapport and walking away feeling like they were taken seriously. If you have to go there where you're kind of talking about some weird nuanced things that, not very likely, whatever, you kind of want to introduce that after and just say, this kind of resonated with me and here's why. And I did find a couple of articles, namely this one. Now they might take something out of your hand and throw it right in the garbage. That's fine. But that's maybe a way to introduce that where you're not like telling them what to do. And at the same time, you won't be derailing your own workup. So that last tip was kind of a mouthful, but it's really important. Okay, finally, tip number 5, and I have seen this as much as tip number 4 maybe highlighted a mistake that patients make when they enter into the relationship and want to discuss any particular thing they have in mind. There's also a mistake that I have seen a couple of times that practitioners make that could be devastating. And by the way, this doesn't mean people are bad practitioners. The issue is that people who are nurse practitioners, people who are doctors, people who are like anything in the world, these jobs are done by people, and so you have a bell curve of people. So there are nice people, there are not nice people, there are flawed people, there are people that make mistakes sometimes, there are people that are wonderful at their work, and one day they have a bad day. So this is all just part of working with people. But there is one broad category of mistake that I have seen, in my opinion, and that is as follows. In my opinion, and again, I'm not giving any medical advice on this channel, no individual advice, and nothing that I say should be deemed a substitute from that for the advice of your own practitioner. But in my own humble opinion, anxiety medications, psychotropic meds, antidepressants, and those kinds of things, mood-altering medications, are not a replacement for a thorough workup. There's a lot of nuance here, and of course, if you have your own anxiety that's being treated, because you have anxiety that's being treated, that's between you and your practitioner. Far be it for me to get in the way of it. Myself personally, I think that we do have an awful lot of that. I think there's finally some acknowledgement now, widespread acknowledgement that we've kind of over-medicated people for anxiety, depression. We kind of use these things interchangeably. I think anxiety to some extent is normal. It has a purpose. Fear is normal. Sadness is normal. Grief is normal. All these things are on the spectrum of normal emotions that we have, and each one has its purpose as long as it doesn't get out of hand. Same thing is true with emotions that we think of as positive. I personally prefer to treat or start with something like meditation and yoga for anxiety, things like that. But that's a whole other discussion. But these things do not replace a thorough workup. I personally know of 2 cases, and these were in my own personal life, people I know well. 2 cases where this almost became a huge problem. In one case it did actually, but it might have been life-threatening. And I've heard of any number of them that are not ones that I know well, that people I'm not related to or anything like that, but just in clinical practice. I'll give you an example of one that was just devastating. It was a young woman, maybe middle-aged, 40s, and had a history of anxiety. So I don't know if she was taking anxiety meds at that time, but had taken anxiety meds at least in the past, and went to her primary care doctor complaining of some jaw pain. And the primary care doctor thought, well, jaw pain, anxiety, very often, yes, because people who have anxiety maybe clench their jaw. And she just upped the dose of the anxiety med and sent her on her way. And the anxiety was essentially dumbed down to the point that she sort of quit worrying about this thing until it became a whole lot worse. And it turned out she had a tumor and needed some reconstructive surgery by the time this was properly diagnosed. That's an extreme case, and I'm not trying to, scare the crap out of anybody, but, and it is exceedingly rare. But, these medications probably have their place, but I was personally offered something like this. I had a like situation where I went in with something that was weird, bothering me, and the practitioner offered me some of these meds, and I said no, and it turned out that the condition worsened and the condition declared itself, and then I finally got treatment. I needed some big surgery, so I was really glad I hadn't taken anything to kind of dumb down my concern about it, and he felt really bad about it. But so here's a tip on how to deal with that when that's what you're offered, because it feels awful, right? You feel like you're so belittled, or like, oh, you're saying this is in my head, like it's just an awful feeling. And I think very often we tend to react from our feelings that we're getting as a result of being offered, like, oh, I'll give you some anxiety medication for that pain you're having. Yeah, so the thing is, you still want a good working relationship with this practitioner. You don't want to start doing this, right? Because you're in this relationship now, and maybe you'll go find somebody else, but right now you're having a problem, and so you don't want to lose them. And it might be, that this person is very humble and will stand corrected later on. It could be that they're right, by the way. But the way to handle that is, in my opinion, and the way I handled it, it worked well. And that is that I just I got real quiet, and I just said, I'm not opposed to thinking about that. I was actually, but that was a lie. But I'm not opposed to giving that some thought. But I don't feel comfortable with that at this point. And I might even go so far as to say, I would only really feel comfortable with that if no matter how unlikely you think that this is some other problem, if we were, to do the proper workup on this issue. What you don't want to do is start accusing them of dismissing you, and, even though they are. Again, I think that you still ultimately want to do what's best for yourself, and you still want to get the most out of this relationship. And, again, people are flawed. And this could be a good learning experience for both of you. So in my opinion, I think it's better to forego those kinds of things until after everything else has been thoroughly investigated, or only opt for those types of options if at the same time your complaint is going to be thoroughly worked up, or you've had the proper subspecialist opinion, like perhaps with a psychiatrist. So that's my opinion anyway. And so I hope this is helpful. Again, I do think there is such a thing as what people call this, like, gaslighting, but I agree that I just don't like that term, because there's usually some things that we can do to help ourselves to function more profitably, I guess I would say, in a situation like this. Now, there are certain things that render you more at risk to having this problem. One is being female, because female complaints, this has been studied, are more often dismissed than same complaints coming from males. The other thing is, I think some more nuanced kinds of issues like autoimmune disease, things that are a little more, they tend to surprise you a little bit, that you have to have a certain amount of tolerance for uncertainty with things like autoimmune disease. And they do tend to be tied up a little bit in your psych state. Like if you're particularly stressed, it can aggravate your autoimmune disease. That doesn't mean your autoimmune disease is psychosomatic, but your brain and the rest of your body are connected, very much so. So I think for that reason, things like autoimmune disease tend to be so unpredictable, and I think that makes some practitioners a little uncomfortable. I mean, all of us like to be able to walk in a room, talk to a patient, figure out, okay, here's the plan, and the plan works, and everything's great. And, nobody likes it when they can't quite get it right. That's maybe what that feels like. And so sometimes you have to be comfortable with a certain amount of uncertainty, and you have to be comfortable with people maybe not knowing right away. Maybe we just don't know yet. And people might not even be aware of their own discomfort of saying, I don't know. But the truth is, there are some things that you never get to the bottom of. And that's okay. As long as you're able to keep monitoring and you're able to keep advocating for yourself. So let me know if this was helpful. If any of you guys want any particular points you want me to elaborate on, or if you've had some experience of your own that maybe this will help you. So until next time, be well. Bye-bye.